Hey there, I'm Dr. John. This is Haley. She's going to help me out today. Do you know any moms that have extremely long labors? Do you know moms that have unwanted interventions? Maybe they've had inductions or C-sections. Maybe you've had challenges with baby positioning. We see lots of moms with babies come in with their transverse or breech, and when that happens, it has a lot of challenges having the ideal birth process you're looking for. We hear a lot from moms that just say they have their typical pregnancy pains. When you're pregnant, you don't want to put a lot of medications in. You're trying to stay as natural as possible. Chiropractic is a great way to help moms have a more natural, comfortable birth process. What I want to do first is go over the anatomy. What are we talking about when we're looking at moms, when we're looking at their structure and how to have a more efficient, healthy pregnancy? Our major focus is on the pelvis. Your pelvis is made up of these two wing bones called your ilium, and then your sacrum in the middle. Your sacrum is a triangle bone. The most important thing for pregnancy is this triangle bone. During the delivery process, this bone moves, and actually throughout birth, the movement of this bone actually has a huge amount of implications or impact on the uterus and the shape of the uterus, and creating constraint on the baby so the baby can get in the best position. That leads us into a technique that we call Webster's technique. Webster's technique is all about trying to make sure the sacrum's in the right position and making sure there's no tension around ligaments of the uterus so that the uterus can be in the best position for birth. So the babies can get in the best position to have the most efficient birth process. The visual I have for the Webster's technique is you've got your ring here of your pelvis. It's like you've got a balloon sitting there. And with that balloon, there are two ligaments that go from the back of the balloon to the sacrum, and two ligaments called the round ligaments, which most moms know of. They go from the front of the uterus to the pubic bone. Now, if I take that balloon, or if I take those strings and I rotate it, it's gonna pull on those strings. If it pulls on the strings, if you can imagine what that balloon would do, it's gonna change shape. It's gonna create some tension and torsion. And as it does, it can stop the baby from getting to the best position, either to have the ideal birth process moms are looking for, or it just decreases the efficiency and makes things take longer. So what I'm gonna do is I'm gonna introduce you to what an adjustment looks like for these moms. There's lots of different ways to adjust moms. With Haley, I'm gonna show one technique where we turn her on her side to adjust the sacrum, and then show you what we does when we work with the round ligaments. So, moms like this process because they get to lay face down. And most of the time, well, with babies, they don't get to do that. So this belly piece drops away, and we actually have these great pillows that fit just like this. So I'm just gonna have her lay face down, and I'm gonna show you what the leg check looks like. It lets us know what's going on with that pelvis. So what we do to analyze the pelvis or that sacrum is we look at her legs, and we're gonna bring them up. And as we bring them up, what a lot of times we'll notice is there's gonna be more tension on one side than the other. And what that tells me is that's the side that the sacrum is rotated to. And so our focus is gonna be to get that sacrum back where it's supposed to be, to get that tension off the uterus and to create better mechanics of the pelvis. So I'm gonna have you turn on your side facing me. With adjusting moms this way, especially pregnant moms this way, it's really important to keep this perfectly straight and not create any rotation within the pelvis. So, good, perfect. Now we're just gonna have you go face up. So that sacrum just moved right back into place. If we were to recheck her legs, they would have the normal tension on both sides. With Webster's technique, the round ligaments go from the top of the pubic bone to the top of the uterus. So what we're gonna do is we're gonna contact them. And what it is it's actually on the opposite side that sacrum rotates is normally the side that round ligament has some tension built up in it. So we're gonna be on this side, and we're gonna feel along that round ligament. And we'll find an area that just has some tension, or those muscles around that ligament are really tight, creating that constraint. Sometimes there's a little tenderness or ticklishness, but typically it's not that severe. And so we'll just hold some tension, hold some pressure, You'll feel it after a few seconds, you'll feel it release. Okay. And then that's Webster's technique. This will help to have a more efficient birth process. It'll also help decrease intervention. They did a study, and moms that saw chiropractic care from 20 weeks on, their first-time moms actually had a 24% decreased time in labor, and second or third-time moms, it was actually 33%. This constraint on the uterus also creates a lot of tension within the baby and a lot of stress on the baby. So that a lot of times in the babies that we see creates that first misalignment. That misalignment, or what we call a subluxation, can lead to colic, can lead to reflux, nursing issues. And so it's really important that not only we see a lot of the moms through their care or through their pregnancy, but we also get to check a lot of babies to make sure they're functioning optimally as they start their life. If you're a mom and you're looking for a more comfortable, more efficient birth process, we'd love to help.